Good afternoon, everyone. Thank you for joining us. Welcome to our CERAH speaker series for the month of April. My name is May Remenda, and I'm a knowledge broker at Lakehead University's Center for Education and Research on Aging and Health, or CERAH for short. I primarily support the delivery of palliative care education to healthcare providers across Northwestern Ontario. Before we get started, I'm going to go over a few housekeeping remarks. Please keep your microphones muted unless you're asking a question. We are recording today, and in terms of Q&A, Dr. Klarner Read said that she'll do her presentation and we will do a more formal Q&A at the end, but we're also open to you asking a burning question if you'd like to. You can either pop it in the chat and I'll bring it forward for you, or raise your virtual hand and we'll get to you there. After the session ends, an evaluation survey will pop up, and we would really appreciate it if you could complete that survey for us, as it helps us inform our future webinars and our future events. While we are joining each other virtually, as the host of this session, Lakehead University respectfully acknowledges its campuses are located on the traditional lands of the Indigenous people. Lakehead University in Thunder Bay is located on the traditional lands of the Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. Lakehead University acknowledges the history that many nations hold in the areas around our campuses and is committed to a relationship with First Nations, Métis, and Inuit based on the principles of mutual trust, respect, reciprocity, and collaboration in the spirit of reconciliation. As a center, we are committed to working towards reconciliation and decolonizing our work, and have committed as a staff to educating ourselves in these areas, both personally and professionally. For myself, I openly discuss with my children the ongoing impacts of colonialism, as well as racism, and the importance of recognizing it and challenging it. I'm committed to raising my children to be vocal and proactive about being anti-racist, and I encourage them to stand for equity and reparations for Indigenous peoples. We would love to know where you're joining us from as well. So if you wouldn't mind, you can pop your name and your location in the chat, and we will get underway here. Finally, on to the introduction. Dr. Taryn Klarner Read is an associate professor in the School of Kinesiology within the Faculty of Health and Behavioral Sciences at Lakehead University. With a strong commitment to community-based research, Dr. Klarner Read's work aligns with Lakehead's mandate to serve and support local communities. Her applied research focuses on the design, feasibility, and effectiveness of community health and exercise programs for older adults, particularly in Thunder Bay and Northern Ontario. And with that, I am going to pass this off to Dr. Klarner Read and stop talking.
Awesome. Good afternoon, everybody. Happy Wednesday. I'm in Thunder Bay, and we have a beautiful sunny day here to enjoy. The snow is finally melting. I'm happy to be here. Thanks for joining me over your lunch break. And today we are going to talk about a very special exercise program in Thunder Bay. And you can't see my screen, I'm sure you would have let me know, but hopefully you can see my title page. Thanks, May, for the confirmation. A very special exercise program in Thunder Bay called Keep Moving. And this presentation is about how we have expanded and evaluated that program so that it can be beneficial across Thunder Bay and across our region. I'm going to tell you first about some benefits of exercise, hopefully encourage you to have a busy and active lifestyle, and then we'll get into the program itself. So as May said, I am an associate professor in the School of Kinesiology. Kinesiology might be a newer word for folks. Kinesiology, the kines part of the word means movement, and ology is study of. So in kinesiology, and I have some colleagues joined us today, we study movement. We study why we move, how movement impacts us, how it impacts our community, all through the lens of healthy well-being. I'm also a mother, I'm a wife, I'm a daughter, I'm an Easter egg hider this weekend. So really happy to bring some knowledge to you. I'm also a teacher. So as a professor, we teach. So I couldn't help myself, but we're going to go over some knowledge that I can share with you from my teacher lens. So first, we'll talk about exercise and the benefits of exercise. There are so many benefits of exercise, and we have known that for a long time. This is an image of Aristotle, and Aristotle wrote in his Nicomachean Ethics, which is a book on how to live the good life, he wrote about the benefits of exercise. And he said that insufficient exercise destroys one's strength, and both eating or drinking too much or too little destroys health, whereas the right quantities of all of those things increases and preserves it. And this is a good quote to think about as we move into a long weekend this weekend. Exercising, eating, and drinking, they're all important, but they have to be in the right amount of balance. So for at least 2,300 years, we have known that exercise is beneficial and it's important to the good life of being a human. Here's a much more scientific definition of exercise, that exercise is planned, it's structured, it's repetitive activity aimed at improving or maintaining health. This is from the National Institute of Health. They're an American organization, and they coined this very scientific, quantifiable definition of exercise. And this definition has been used in the literature tens of thousands of times. However, that word exercise, it sometimes gets a bad rap or a bad connotation because it implies that there's something extra that we have to do. We have to move out of our house. We have to put on some uncomfortable outfit. We have to drive our car. We have to go to a gym. It connotates something extra outside of our regular physical activity. So the World Health Organization, they very intentionally don't use the word exercise. They use the word physical activity. And their definition is any bodily movement that's produced by skeletal muscles. So this is really every single movement that we do. Humans are made to move. We're designed to move. It is what has kept us alive for thousands of years. Movement will continue to keep us alive. Our bodies crave movement. If we stop moving, bad things start to happen. So I like this definition of physical activity better, and especially how it applies to maybe an older population of people, because it's less pressure. It's easier to access. It's just regular movement in the backdrop and background of our regular lives that we can engage in. One thing that everybody agrees on, at least the World Health Organization, the National Institute for Health in America, and even our own Canadian Society for Exercise Physiology, one thing we all agree on is that you need 150 minutes per week of moderate physical activity to stay healthy. And these are the guidelines across the age spectrum, from young adults to middle-aged adults to older adults. It's 150 minutes per week. This definition, there was one time in our history that didn't apply, and it was during COVID when we were all locked up in our bedrooms doing our work. The WHO, they deleted the 150 minutes per week, and they literally said any amount of exercise that you can possibly get in during this time is beneficial. So it was anything above 0 minutes was their recommendation. And I actually really like that definition during the COVID time, because it didn't make it feel like something you couldn't attain. Any movement was going to be beneficial for you. And what we know too is that the quality of exercise is better than the quantity of exercise. So we've been advised by the WHO, World Health Organization, and the NIH to engage in moderate physical activity. And this is good because that is relative to you. Maybe you went to the Olympics for hurdling. I just said that because our boss is on the screen, and he did go to the Olympics for hurdling. So maybe you need to play hockey and engage in golf, and that's your level of exercise. But that moderate, it means it's relative to you. And you have a really good sense of when you're working at that moderate level. Moderate means it will be hard for you to sing. It will be hard for you to carry on a conversation and engage in speaking with somebody else. And your perception of moderate exercise is correlated to actual moderate exercise. So if you perceive you're not being able to sing or to speak, that is exactly the level of exercise you should engage in. That might mean shoveling the driveway. Maybe it's sweeping out your garage. Maybe it's folding your big bed sheets at home. It's all relative to your own personal level of previous engagement. And I like that physical activity definition because it's just suggesting that we increase the background of movement in our lives. So The sun is out, maybe we're going to walk to work. This is for me, maybe we're going to walk to main campus instead of drive our car from the field house to main campus. So any ways that you can increase just background movement, active transportation, healthy living, these all qualify as exercise and as movement. There are tons of benefits. I have roughly divided these benefits into 3 categories: physical benefits, social benefits, and cognitive benefits. But there are many more than that. From a physical standpoint, our structure changes and our cognition, our thoughts, our function changes as well. Aerobic capacity increases. This affects our cardiovascular system, which is the heart and the lungs and all those tubes, the arteries and the veins that pump the blood around our body. It improves the distensibility of our arteries, remains more pliable, so they're not rigid, so that if you have really high blood pressure, the blood isn't going to spill out from your arteries because your arteries are stronger because of exercise. Exercise helps us maintain weight, which can help us decrease the incidence of adult onset or type 2 diabetes later in life. Exercise helps decrease other diseases, cardiovascular and cerebrovascular diseases that can affect our heart, such as heart attack, angina, high blood pressure, or the cerebrovascular diseases such as stroke or a transischemic attack, which is a mini stroke. So exercise, not only does it help you improve your health, but it will decrease your incidence of getting a disease in the future. Exercise also improves our muscular strength, our muscular endurance. It increases the density of our bones, so that if you were to fall, and falling is a common thing that happens in all adult populations. I was walking my dog this morning on an icy trail, almost fell. So having exercise and stronger bones as a result can decrease the incidence of injury should you be falling. Exercise, it also helps you feel like you're doing something towards getting better. My husband just found out that he has gallstones, has to get them removed in a surgery. He's cleaned up his diet, and he's also exercising now intentionally to think about the gallstones. Like, will the exercise eliminate gallstones? No, it won't. But it makes him feel like he's doing something to get better. So it's that action orientation towards healthy well-being and healthy living. Coordination improves with exercise. Reaction time improves with exercise. And this is really important when we're piloting or driving, when we're driving through town, being able to quickly stop or quickly react to some sort of accident on the road. Exercise improves all of these structural facets of our body. Exercise also improves our social engagement, and it improves our social well-being. So it will help you sleep better. It will help you concentrate. It will help you preserve your energy. It helps you have an engaged social role with your community. And this is really, really important. For the first time ever, we are recognizing something called the loneliness epidemic. These are epidemics that are worldwide. They spread across the world. First, it was an obesity epidemic where a lot of people were at an unhealthy overweight size. During COVID-19, of course, we had the COVID-19 epidemic, but now we have something new called the loneliness epidemic. And this is really concerning because people are lonely and people are okay with being lonely. But what we have found is that loneliness increases your chances of acquiring disease or disability later in life. And exercise can help you stave off those lonely feelings. And there's a new model in healthcare, a new area of healthcare called social prescribing. And this is prescribing things like exercise that make you be social, that make you increase your contacts with people in your community. This is another benefit. And they have found that cities that have more public funding on social engagement or social activities, doesn't always have to be exercise, they have healthier communities. More public spending equals a smaller incidence of comorbidities in the population. So This is, as I said, a brand new area that now healthcare practitioners are realizing this benefit, and they're giving you a prescription to go join karaoke or go be social, go talk to people. And exercise is a great way for that to happen. Currently, OHIP, they won't pay for social prescriptions. My private healthcare package won't pay, but this is a brand new field of research. So hoping it's something that will change. And as we focus more on proactive health instead of reactive health, perhaps our governments will pay for a social prescription in the future. But the area that really gets me the most excited on exercise are the cognitive, the brain benefits of exercise. If I was giving you this talk maybe 30 years ago, I would have said nothing changes in the brain. How your brain is how you are. There are no changes. But that's not true. With our advances in technology and how we can measure the brain, we are noticing that the brain changes. So here is the image. Here's an image of the hippocampus. The hippocampus is a structure right behind the temporal lobe, which is right behind your ears. It's a deep structure of the brain. It's involved in memory formation. And not just memories like, oh, I remember my kid's name, or I remember what we did 2 Christmases ago. It's memories, the hippocampus is involved of memories of where am I in space? Where are my keys in my house? Are they in my purse? Are they on the side table? Where am I in this grocery store? Am I at the front? Am I at the side? So we have special cells in the hippocampus called place cells and grid cells that orient us in space. So these images here, these images are from mice. The work that we can do in animal models is very different than the work that we can do in the human animal model. So these images are from mice. And to be totally honest, I like to be totally honest when I'm teaching. These animals have to get killed after the experiment so that we can take slices of their brain, stain the tissue, and see what's happening. We can't do that in a human animal. It's not legal, ethical, or moral. So we take a lot of information from animals. So these are mice. They had some mice just sit, chill in their cage, and they had other mice running on the treadmill, and they would run on the treadmill like crazy. And then they looked at the dentate gyrus, that's a special part of the hippocampus, and stained it. Your hippocampus isn't usually green, they just stain it green, so we can see it here. And we can see that the cells of the hippocampus, the neurons, actually increase with exercise. So on this first, I'm looking at panel runners B, we can see more black dots. Those are the actual axons, the cell body of the neuron that's being produced by exercise. We can also see in this panel F here, the dendritic branches. Dendrite is Greek for the word tree, and you can really appreciate the tree structure in this green image. More branches, more proliferation, which means more opportunity for those cells to communicate with other cells. When the hippocampus has more cells, we have more of an ability to remember things, and it improves our memory. So exercise also increases our structural function, as we just talked about, but it also improves your cognitive function. So this study was done in mice, as I said, but here is some evidence from humans. In humans, we have to look at their active, alive brains because that's the ethical way to do research with humans. These are images, fMRI or CT scan images. And this first image here, we're looking again at the hippocampus, so the exact same structure we just looked at with the mouse model. And here they're looking at the volume of gray matter in the hippocampus. Right now, there are red and green blobs over the hippocampus, but what we can see is that after exercise, the blobs get bigger. The green and the red size gets bigger, which means our hippocampus gets bigger. We can't look specifically at the cells like we do in the mice model or other animal models, but we can infer changes in our brains. This image below with the fancy colors, I always love to show these fancy color images because they look really impressive. But the color is a representation of how much oxygen is being delivered to that part of the brain. So it's another proxy measure to determine brain activity. Your cells need oxygen to work, so the more oxygen that goes to those cells means that the cells are working more. So when we see a dark red, it means that there's more activity in that area. So we can see after walking for 20 minutes, and just a walk, this isn't even maybe it is exercise for some, but this is more low intensity. We see lots of that red activity in the parietal lobe. We see involvement of our frontal lobes. We see a lot of interhemispheric contributions, which means both sides of the brain is working, which is to say that our brain activity also changes as a result of exercise. I'm not done. I've got more for you. Another experimental line of evidence that researchers look at is a protein that our body makes for the brain. It's called BDNF, brain-derived neurotrophic factor. And this protein is another marker, another way to infer that our brains are changing. This protein is like fertilizer for the brain. So if your body is making BDNF, it means that your brain structure is changing in some capacity. More dendrites are being grown or structures are being reorganized. BDNF we can extract from saliva. So you just get people to spit into a tube, you can run it in a centrifuge and then pull out the BDNF protein to approximate neuroplasticity or change in the brain. So as we engage in aerobic training, resistance training, or a combination, BDNF increases in our bodies, which tells us that our brains are changing. And then finally, this one's really exciting. This is a study that was completed over a long time, a decade, I believe. They recruited 30,000 older adults in Canada and then monitored them over time. This study was a regression analysis approach. So what they do for a regression analysis is take a whole bunch of variables and then see which variables may predict something. So in this study, they found that the largest modifiable risk factor for dementia is physical inactivity, where over 10% of your risk for getting dementia later in life is because you're not physically active. We have lots of risk factors to getting dementia. Some of them we can modify, some we can't, like who your parents are, your genetics. We can't change that one iota, but physical activity is something we can change. So engaging in exercise actually decreases your chances of having dementia later in life. So all of this to say that exercise is super beneficial for improving our physical selves, our social selves, and our cognitive selves. So physical exercise, it improves physical function and maintains physical function, but it also can be used to rehabilitate physical function, to get somebody who had an injury, an accident, a disease, a disability, not back to normal function, but to improve their overall capacity. So this is an image I love to share when I'm teaching or giving talks. This is what I study. This is the nervous system. This image was taken from Body Worlds, which is a traveling exhibit by, I wrote his name down so I don't mess it up, Gunther von Hagens, who is a German physiatrist. So he studies the spinal cord in the brain, and he used this technique called plastination. So fill the tissues with plastic. These people had already passed. They had donated their bodies to science. And then fill the tissue with plastic and then dissolve away all the other tissue that you don't want to see. So in this case, what we're looking at is just the nervous system being preserved. You can see the brain right at the top of the nervous system. You can see the spinal cord and all the wires. I call them wires. They're axons and nerves. All the wires that carry information away from the brain and spinal cord to the muscles, to the organs, to the skin, and all the wires that carry information back to the spinal cord so that our brain and our spinal cord can know what the heck is happening as we're moving. I love to talk about this image when I'm talking about kinesiology because to me, kinesiology is the study for everybody. It doesn't matter what color your skin is. It doesn't matter what political party you're going to vote for in the future. It doesn't matter what hockey team you really like. Do you like country music, rock and roll? It doesn't matter. We all look like that under our skin. We all have a nervous system. So to me, kinesiology is a study that unites everybody. And I teach a class about gerontology, about physical activity in our older adult populations. And I always encourage the students to consider a career in gerontology because number one, you'll always be gainfully employed. There's lots of work for you to do. And as our population ages, you're going to have even more work to do in the future. So I always encourage students to think about our nervous systems and how they change. And our nervous systems do change with exercise. In my other line of research work, I do more applied basic science, where I'm just trying to understand the structure and function of our nervous system in a healthy adult population. And if you have something like a brain injury, like a stroke, which is a lack of oxygen to the brain, or a spinal cord injury, or Parkinson's, which is a decrease of those dopaminergic neurons in the basal ganglia part of our brain, your brain inputs are changed. Something is different. I put a big X on it. Doesn't mean you have no brain. It's just there's something different. But we can use, through exercise, through rehabilitation, we can use movement to train the rest of the nervous system. And the rest of the nervous system is amenable to change after exercise. And so I applied this in my work as a grad student to working with people who had spinal cord injury and stroke. So here's an image of myself and a patient with spinal cord injury. And we were trying to rehabilitate walking. So we used this big machine here. It's called the Lokomat. This machine costs $750,000. It's very expensive. There are a few of them in Canada. At the time, there were only 3 in Canada. We have Goose Egg in Thunder Bay. We have no Lokomats in Thunder Bay. But we were looking at how can this walking robot improve walking after something like spinal cord injury. In other graduate work, I looked at how do we make this rehabilitation accessible to people who don't have $750,000 to go buy a Lokomat. Actually, one Lokomat west in Vancouver was bought by a very rich dad whose son had broken their back skiing at Whistler. So if you don't have a rich dad who's going to buy you a Lokomat, then what could you do to rehabilitate walking function? So I looked at very practical arm and leg cycling. These arm and leg cycle ergometers are in every gym and every corner of our country. So can they be used as exercise rehabilitation to improve walking? It has similar benefits to this body weight supported treadmill robot. And we even took it a step further to look at if arm cycling, instead of arm and leg, if you can use arm cycling to improve walking function. And you can. So exercise changes our brain, changes our muscles, but it also changes our nervous system to rehabilitate function. Yet, despite all these amazing benefits I told you, we don't all engage in the correct amount of exercise that we should. So the Canadian Health Measure Survey, this is a subsect of our Statistics Canada survey. We do have another one coming up in a year or so. Only 18% of us, of older adults, are meeting those World Health Organization guidelines of 150 minutes per week. There are so many barriers that prevent us from engaging in exercise. Our sex, our gender, if we had early aversive socialization, if you were on a baseball team and they told you girls can't play baseball or something, then you're not going to engage as an older adult in exercise. How much money you have. This is another socially determining factor to your engagement in exercise and healthy well-being. How much education, people who have less education, there's an inequitability, might have made that word up, there's an inequitable approach to how people engage in exercise. If you don't know how to do movements, or if you're just in that vicious cycle, and I'm talking to myself here lots of the times, this vicious cycle of inactivity, it's really hard to re-engage in exercise. We also have perceptions that old people shouldn't exercise, that we don't want to see an old person at the gym. That is a society sort of prejudice towards older adults. So older adults, they might not feel comfortable engaging in exercise. So I worked with Nicole Lee, who I think is here. Hi, Nicole. It was also your last month CERAH speaker. And when Nicole was a student, we spoke to people in Thunder Bay who'd had a stroke, and we wanted to know about their exercise journey. Speaking to people is so powerful. When we teach about research, we say like, oh, you need to do an RCT, a randomized control trial. You need to have a control group. You need to have all these things. But just speaking to the people with the lived experience, this is where it's at. This is what's really powerful. So we just spoke to people in Thunder Bay who had a stroke. And from their voices, they told us that there is more of a need here for community-based rehabilitation services. And from that, we put forward a recommendation in this paper that we want to make access to rehab easier for people in the chronic stage of a stroke. So chronic means it's like 6 months after the acute stroke event. You're out of the hospital, you've been discharged already, you're on your own, essentially. And here's a great representative quote: "You shouldn't need to find your own rehabilitation because you're sick." And I think this is really important. Being sick, that's already a barrier to engaging in exercise. So you shouldn't have to go find your own programs in order to engage in all of these beneficial things I just told you about. And this is exactly in line with what our province recommends. So a couple of years ago, the Auditor General told Core Health and an Ontario Health Network to work together to come up with an ideal plan to engage people who've had a stroke into exercise. So they came up with this community stroke rehabilitation model, and they are saying exactly what we found in the paper, talking to people, that community programs for exercise should be available across our province. I worked a little bit with, as well, the Northwestern Ontario Stroke Network, because the province has said that they want to offer funding to all municipalities in Ontario to increase the amount of community stroke rehabilitation. This was just from the stroke lens, but really it's important for anybody with a brain injury. So we worked on speaking to people with stroke so that we can get ready for when the province eventually doles out the money. I think our province, or our government's a little distracted right now, so we'll give them a break. But when they're ready to dole out the money, we'll be ready to use it in our area. They've released some facilitation guides, but so far as I know, no money has been handed out yet. And this is what the province is saying is the ideal model of care. This is what should be available to people. So in comes the Keep Moving program at the Canada Games Complex. This program has existed long before I was involved. It will exist long after I cease to be involved. This program was actually highlighted by those researchers who came up with the ideal model of care. It was highlighted as a really good community program for people to engage in exercise, be social in the community who had brain injury. So they already gave us a high five for having this program. And I really want to give props to our city of Thunder Bay. Even in my little life, I've lived in all sorts of places in our country. And Thunder Bay, we do a really good job of promoting and prioritizing healthy living for our citizens. I know that because my taxes are very high, and we have lots of facilities that are for people to engage in exercise. The City of Thunder Bay, they subsidize or help fund the Canada Games Complex. This is a city-run organization that is all about healthy well-being and healthy living. So Keep Moving, it lives in the Canada Games Complex, and it's a class for people who have neurological damage. So either they have a stroke, they have Parkinson's disease, MS, a brain injury, and brain injury could be traumatically induced or non-traumatically induced, but this is a class that is for them. And this is all well and good for us in Thunder Bay, but what are the people in Dryden doing? What are they doing in Kenora? What about Fort Francis, Sioux Lookout? You know, what about the rest of the province that doesn't have anything? Brain injury doesn't care. It's going to affect everybody anywhere all the time. So it's good for Thunder Bay, but what about the rest of the community? So that's why we set out to evaluate and expand this program so that we could share it across our region and across the province to help other organizations improve their community offerings. And I've listed a whole bunch of names here. I really have to thank, I've missed a whole bunch of names, I'm sure, but these are the folks that I've been working with lately to do this evaluation and an expansion of Keep Moving. But as I said, this program existed long before me. It was created by St. Joseph's Neurology Output Department with Canada Games Complex and will continue to run after. But the most special thanks has to go to our funder of this work, and that is the Ontario Brain Institute. They had a funding program called the GEEK, growing expertise in evaluation and knowledge translation. And this was unlike any funded program I have ever worked with ever. So for this program, we were assigned an evaluator. Her name was Stephanie. She was the best. We were assigned an evaluator to help us write the grant, organize our thoughts and feelings, be successful in the grant, and help us roll out the grant. Never in my life. Usually the grants are super competitive. They just give you the money, like good luck to you managing all this money. But the Ontario Brain Institute, they did it a bit different. It was really a facilitated grant process where they were involved every step of the way, making sure that we got the money and were successful and that we successfully implemented our program. This is small. I don't need you to read this, but I just wanted to show you this was something that was created before we even applied for the grant. So we could have lost the money and we still would have had this. This is called the logic matrix. This helps you identify and organize who your stakeholders are, you know, what inputs you need, what outputs you're hoping to measure, what are your short-term goals, what are your long-term goals. And it's really important. Not all of these programs would have academics maybe tied to them. So, you know, asking community groups to make this type of logic matrix is very difficult. So I really give them kudos and props, Ontario Brain Institute, for facilitating this grant process for us and also for giving us the money. That's another thing to be thankful for. Okay, so this schematic here, this is an overview of the methodology that we undertook to evaluate Keep Moving. So I'll just go over from left to right, from I guess blue to blue, and talk about each of these components. So initially we recruited participants, and there were several stakeholder groups that we wanted to work with, but we recruited participants who were primarily already engaged in Keep Moving. So as I said, this program's been running, continues to run. So we had both cohorts of the mixed neuro Keep Moving class and the Keep Moving after stroke class. So we had those participants partake in this study because their voices are critical. And doing this type of community engaged research, it is critical to work with the people with which you are affecting. So we included participants of the program. We tested them on a whole bunch of things. We tested their physical fitness. We tested their quality of life, their social position. We tested their satisfaction. We measured their adherence to the program. Did they drop out? Were they successful? Then they completed their 10 weeks of exercise. The exercise is geared towards that disease or disability. So, you know, the exercise maybe was seated, was low impact. It was designed for the people in the program. Then we also wanted to expand our Keep Moving program. So we offered additional workshops. We offered health and education classes to add value to the exercise program we were already running. And then afterwards, everything was done. We measured everything afterwards to evaluate what had changed, if anything. And then we also interviewed not only the participants, but other stakeholder groups that were involved. We didn't have to do this because we were looking at program improvement, which doesn't need research ethics. But we said we wanted to do this work through the lens of research. We had said that very early on in the application process, and the evaluators really liked that. And to me, that is the value added of Lakehead University in Orillia in Thunder Bay, is our integration into the community. So this could have been done just by Canada Games Complex, but I wanted to supply my research lens on it. And research ethics protects the participants, it protects what they say, it gives them anonymity and confidentiality, and it also allows me to publish this work so that we can share it with the greater research community eventually. So this was another matrix that was put together with our evaluator when we applied for the grant, but this just outlines the 3 stakeholder groups of people that we were interested in speaking to. The participants themselves, of course, we wanted to know, were they satisfied? What was their quality of life like? Did they get physically healthier? We also spoke to the Keep Moving team. So these were the fitness instructors, the folks that worked at the desk of the Canada Games Complex, the people who put the program together. And we also wanted to know, what is the impact of this program in the Thunder Bay community? How does it work with referral from hospital into this program? How do patients access the program, and how does it help our community overall in general? All right, so now I'm going to share some of the results of our findings. So the first result here I'll share is from the senior fitness test. I love this test. So I teach this test to my first year university students. I like this test for a number of reasons. The first reason is that it is simple. It's very easy to perform. There are low equipment requirements, low cost requirements. You don't need doctor's note to have someone do this test. It can be delivered right away. And I love that because it means students can be involved in all facets of testing. So I had, I think like 4 or 5 students work with me on the evaluation of this program. I had students work as volunteers in the fitness classes of this program. And as I said, that I think is like our bread and butter at Lakehead, is that we are so involved and ingrained in our community. So senior fitness test is also valid and reliable. It has all those scientific stamps that we want to see when we're running tests, and it's free. So anybody can Google it, can find the information, and can run it out. It's rare that you find fitness tests or any tests that are freely available. This one is, so that's why we use it. And we measured things before and after. The best way to do it is to measure a couple times before and then once after, so that you can establish the baseline variability of your participants. You know, how do you know if just like this one day they were feeling strong or not strong, or happy or not happy? It's best to do multiple baselines, but for this project, we just did a singular baseline. So that is sort of a limitation of our design. Multiple baselines take more time, so you have to do the test like 3 or 4 times. But it's a more valid way of assessing change overall. These were some of the domains of fitness that we were testing. We were looking at strength, range of motion, endurance, and these are the results of those tests. So all the blue bars are before the 10 weeks, all the orange bars are after the 10 weeks. The vertical skinny bar, that's called standard deviation. That represents how much variability there is in these results. But what's important is to see how things change. And we can use tests like a t-test to measure change over time. So everywhere you see a star means that there is a significant change over time. And in all of our cases, the people get better. So they have more strength. The chair stand test is where you stand up and sit down. It's measuring lower body strength, arm curl, upper body strength. People become more flexible. Their range of motion increases. In the sit and reach, these negative values, they indicate that the person, you reach for your toe and try to touch your toe. Negative means that they didn't even touch their toe, and positive means that they went beyond their toe. So our participants, they went from not even being able to reach their toe in the sit and reach to stretching beyond it. So flexibility improved. The only thing we didn't see an improvement on is the 6-foot timed up and go test, that there was no change before and after exercise. It's not like altogether too surprising that physical fitness and function improved. I just spent like 20 minutes telling you about all the benefits of exercise. So we expected to see that things are going to get better. But what's significant is that this was a low volume of exercise, what the participants were doing. And even with this low volume of exercise across differing populations, even they improved. And if I was giving you this talk 30 years ago, I would have said, oh, you're 70, you've had a stroke, just sit in the corner, sedentary life for you, nothing's going to change for you. I have worked with 92-year-old people who had a stroke 20 years ago, and even they improved from exercise. We also measured balance and gait with the Tinetti test. And while we did see statistical significance, we did not see clinical significance. There was only a change by 1 point, which is pretty meaningless on this test. So that's something else to think about when you're working with patient populations, is things could be statistically significant, but are they clinically meaningful? That's a whole other thing. Okay, so fitness improves after exercise from this Keep Moving program. We also measured quality of life. And this measure here, the NeuroQOL, this is an American-made tool. Again, it's free. I love to advertise these tools that are freely available. This tool was made by people with brain injury for people with brain injury. It's very simple to use. It's an online test. You can do it online. You can print it out hard copy, and it measures quality of life. And we found that after our 10 to 12 week program, that there was an increase in perceived limb function. People felt more of an ability to participate and being more satisfied with their social activities, and they had a higher emotional response. In speaking to the people, we found three main themes, three things that people really liked about our program. And we had many participants say these themes over and over, so we knew that these were things that our participants were liking, and not just our participants, but the stakeholder group that manages and runs Keep Moving. They liked that our physical activity was accessible. They liked that we had community offerings and also that we had educational workshops. So in terms of types of exercise, we had the standard, fitness class exercises, but we also brought in a Zumba instructor and a yoga instructor to offer seated Zumba or seated yoga. And we also allowed the caregivers to participate as well. So this is really important. Caregivers are as important in the rehabilitation journey compared to the person itself with the brain injury. So this was a quote from one of our caregivers that they're being allowed to join our fitness class and not just like sit in the corner, but they had a seat in the circle. That was a huge benefit for them that they could be engaged. We also considered cost of the program. Well, I don't think these programs need to be free. If people can pay, a nominal fee is appropriate to charge. And the format really matters. Oh, the lift. Oh, the lift. Oh, we have this service in town called the lift. This is not unique to Thunder Bay. When I lived out west, it was the Handy Dart and we had equal barriers. But somebody who doesn't have reliable transportation, they have to call the lift like a week before, book their ride to the complex. Usually it gets canceled or delayed. This was a major barrier. So we also offered some classes in an online format. And the Heart and Stroke Foundation, they have online fitness classes that facilities can buy in order to engage their clients. Not only did we have the fitness classes, but we expanded the fitness classes to have community involvement. So we had our fitness classes twice a week, but we also took participants out into the community. We went to the museum, we went to the conservatory, we went to the art gallery. Frankly, I think they would have been happy if we just got a table at Tim Hortons. They really enjoyed just being with each other. And we need to improve the well-being as well as the fitness. And we also offered educational classes. So we brought in a nutritionist, we brought in a falls prevention specialist to speak to the older adults about nutrition, about the Canada Food Guide. And this will enable the participants to live autonomous, well-meaning and having high well-being in their life, because we're giving them the tools to know about nutrition. And here this one participant said that they spoke to a dietitian many years ago when they had their stroke, but were surprised that everything had changed since that time. And this information was really valuable. So to think about not just the exercise, but what else can we offer? This schematic here, it outlines all of the good things from our program. So this was from our community participants, our fitness participants, and the Keep Moving stakeholders. These were all of the benefits that we saw in our program. And our mission, our challenge with this GEEK funding, the generating expertise in evaluation, we had a knowledge translation component where we shared all of our findings in a toolkit. I have it somewhere around here. A toolkit that we want to share with other communities like the Drydens and the Kenoras and the Sioux Lookouts that maybe need some guidance, just like the Ontario Brain Institute helped us. Maybe we can help other communities in our region to establish their own Keep Moving programs. And in this toolkit, we give them how to evaluate your program. We give them a booklet on everything from even what fitness instructors should wear. How can we integrate volunteers into the program? What are some exercises these folks could do so that if your fitness instructor doesn't know where to start, we've got some information to start. How can you Be prepared in your facility, have an emergency action plan in line. We also give manuals or guidelines on how to track participants, and we have just given them the exact survey questions that we ask participants in an effort to help other communities grow their Keep Moving programs. And that is our long-term goal, to set up a community of practice where we can engage with our Northwestern Ontario community to increase the amount of community-based exercise for older adults. And again, thank you so much for your time and listening. Here's some images of our participants just moving their bodies. And I really encourage you all to keep moving, to get busy and to stay fit and to stay active for our bodies and most importantly for our minds. Thank you so much. And I'm happy to chat for a bit if anybody has any questions or any comments. Thank you.
Thank you, Dr. Klarner Read. That was very enlightening and also scary because I don't think I move 150 minutes a week. So when is it too late?
Never. It's never too
Okay,
late.
good. I wrote
Yes,
down some
as I
questions.
said, my
Yeah, no, thank you.
92-year-old participant. Yes.
Thank you very much. I think that that was the kick in the pants that I needed for myself and some older family members that I really care about.
Good. Yeah, and it doesn't
And
have to be difficult. It can just be gardening. It can be walking. It can be, my husband insists that we put our mattresses on the floor so then he has to stand up from a lower position. So there's all sorts of ways to just increase the background of movement in our lives.
that's very creative. Yeah. For those alarm clocks that when it goes off, it like takes off your dresser and like rolls away. So you have
Oh,
to get up and chase after it. Maybe I'll get one of those.
exactly. That's a great idea.
Yes.
Exactly. Anyway, to just keep our bodies lubricated and
Yes.
moving.
Wonderful. Does anybody have any questions or comments? We have some comments. Oh, Kathy says that was great. Oh, go ahead, Dr. Newhouse.
Hi, thanks, Taryn. That was great. I was wondering about your strategy for trying to move it to the region more. And so you mentioned that you do it online. So is it possible for people in Dryden, whatever, to join online with you?
Yep, absolutely. Yep. So that is the benefit of COVID. It's the only one I can think of, is that we prove that an online model works. So yeah, so we would welcome people from all over the province to engage in virtual online classes. So one barrier is accessibility to the internet, though. You know, if there's no reliable connection, then they ain't joining us. So that's another barrier to engagement and something that we definitely need to improve in Northwestern Ontario.
And I was thinking of another strategy, that your journey with this reminds me of our journey with the weekend program. And then the weekend program borrowed a whole lot from cardiac rehab. And there's not a whole ton of difference actually to the actual exercise program between the different chronic diseases. So if you thought of maybe in a small community where you really don't have the population of stroke patients, to have them join in with the cardiac rehab patients or things like that.
Absolutely, definitely, yes. And even in this Keep Moving program, we welcome people with Parkinson's, stroke, MS. These are all very different disease ontologies. So all are welcome and all should be included, including the caregivers, like I was talking about in the presentation. And the exercises can be simple, can just be lifting a ball, just standing up out of your chair. They can be easy things. It doesn't have to be challenging. I think that's what's a really important message, that exercise should and could be accessible to all. Including you, Dr. Newhouse, next year. Even though you're retiring, I've already included you in my online exercise.
There's a question in the chat that actually, following up on those exercises, that says, this was fun. I work for the Victorian Order of Nurses as a fitness instructor, and this is 100% the demographic of participants we provide services for with our SMART program.
Awesome.
Is there a way to see specific exercises you utilize that I could share with my supervisor?
Absolutely. Yes, I would love to share our entire guide with you, Amanda. And there are lots of great programs out there that promote exercise. And I think knowledge is a barrier. So just sharing that information with the right people is really important. So definitely, Amanda, I'd love to share all of the fitness guidelines that you can share with your supervisor. Thank you.
Francis, do you have a question?
I'm up. Hi, Taryn.
Hello.
You hear me? Listen,
Yes.
I understand well, having been at this field for a long time, as the first registered kinesiologist, ran cardiac rehab, stroke rehab in the 80s and so forth.
Yes.
And I understand that groups like this are great, particularly for women and for research purposes. And you have 6,000 registered licensed kinesiologists in Ontario. We get zero funding. Many people, men particularly, and about 85% of cardiac patients, for one, they're not interested in group activities. It's not convenient for them. And as part of everybody's research, we need to be saying over and over again to do something similar to Alberta or Australia, where they fund to get people like me to do the assessment, get them started, and eventually connect them into the community. That was one of the things I did working in Alberta. But that's just one model.
Yeah.
However, as long as we continually, and it's no fault of researchers, however, it tends to look like this to the public because it's always group exercises
Yeah.
led by anybody, right, in any facility. And that's
Yeah.
what kinesiology is all about. And it's not. That's the very end product, except for the
Yeah.
research side, where we get them started, the assessments, the appropriate referrals, and so forth and so on. And hopefully they can either do it at home, which we have no funding for, which is a huge area some of us have lobbied for many years. And or secondly, for those who are interested, which is, as I said, a small percentage, we can connect them with go to the gym or go to the community center or whatever, just like was it Natalie was saying. But anyway, anytime you guys want to chat about it, let me know. I've been doing lobbying for 30 years, and guys like you carry a lot of weight. So thank you for
Yeah.
your work.
Yes, thank you so much. And thank you for paving the initial road for us to continue work on. And absolutely. And the limitation of this work is I usually speak to people who are already engaged in exercise, but that is just, as I told you, it's only 18% of our population. So what about everybody else? As you say, males are very underrepresented in this area of work because of their own barriers to engaging. So thank you, Francis, for saying that, yeah, I can be that voice as well to encourage our governments to put their money where their mouth is and to cough up some funds so that we can live as a healthy community.
It's
Thank you.
it.
And
We are perhaps we provide the most valuable option to the family doctor. 63% of everybody who walks into their office, primary treatment is physical activity and exercise. And until they can send them down the hall, and to get started, at least if they want to, it's just one more tool in the toolbox. But until our politicians get on board. So guys,